Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. This is your host, Dr. Jason Jones, and we are continuing our series on women's health. And if you missed the last two episodes where we talked about estrogen dominance and thyroid testing, you definitely want to go back and check those out. But today we're going to be talking about menopause. Now, you may be thinking, like, I'm years away from menopause. I don't need to know that stuff. But it's what you do now that determines how menopause is actually going to go. But what we're going to talk about today is what it is, but also what's happening physiologically, or essentially what's happening in the body when you are in menopause. Now, you get to this stage when menstruation ceases, and that certainly is a new phase of life for women that's called menopause. And it doesn't mean that you have a health problem. It's a natural biological process. Oftentimes we see menopause as like we need a diagnosis, just like having a baby, it has to be like a procedure, or something. It's like normal, for women to have babies. It's normal for women to go through menopause. And menopause is a stage of life that signifies the end of the woman's menstrual cycle. And this transition stage typically occurs between the ages of 45 and 55. Certainly can happen a little bit earlier, probably shouldn't. Could certainly happen a little bit later. But it's characterized by some changes that progress until the final menses or final cycle in the end of your reproductive years. Now, however, menopause can occur earlier in life due to possibly genetics, some immune disorders, medical treatments, medications, removal of the ovaries and the uterus, for sure. And early menopause is often seen among, women who smoke, and women with chronic diseases. Now, women tend to experience many physical symptoms, even though you don't have to, but you can experience these symptoms around the time of menopause, but not be necessarily because of menopause. Because again, menopause is just an indication that the change of life is happening. You don't have to have symptoms. It should be a fairly smooth transition where you're thinking, man, I haven't had a cycle in a year, type of thing. You don't have to have the symptoms. However, due to certain parts of the body not functioning the way that it should, or the body being able to handle the transition, or it's unprepared to handle the transition, that's when the symptoms actually happen. And they can be things like night sweats and sleep disturbances, hot flashes, what some people call a private summer, reduced sex drive, vaginal dryness, low fertility, irregular menstruation, trouble focusing and learning, and also emotional changes. Now, menopause can lead to anxiety and changes in mood, and you may start experiencing these symptoms before your menstruation ends, and they can actually last for years. However, note that each person's experience is going to be totally different. Okay, some women have full active lives through this whole period of transition, while others may feel a lot worse during this period. In some, it could be anywhere in between. Now, a simple way to feel better and boost your overall health during this stage is to maintain certainly a healthy diet and a regular exercise, because you're feeding your body with the nutrients that it needs and the movement that it needs to help you transition. Now, what's happening physiologically in the body during menopause? Now, menopause is characterized by a reduced production of circulating estrogen. Now, this is the result of reduced sensitivity of the ovaries to circulating what are called gonadotropins, which is a fancy way of saying hormones like FSH and LH, which we're not really going to get into today, caused by a decrease in the available binding sites for these particular hormones. Now, the level of FSH and LH increases during menopause due to low estrogen, and this removes negative feedback on the pituitary gland and the hypothalamus, which is really the controller of your hormonal system, in the endometrium lining or endometrial lining of the uterus breaks down when ovulation does not occur. And this is termed estrogen breakthrough bleeding. You experience this in the perimenopausal stage, and it can happen as frequently as about every 2 weeks. Now, however, bleeding gradually ceases as the levels of estrogen actually decrease. And generally, menopause happens in 3 stages. You have perimenopause. Now, this stage begins many years before menopause when your ovaries produce less estrogen. This period includes the 12 months that follow your last period. It can last until your ovaries stop releasing eggs. Menopause is the next one, and this is the stage when your last period when your last period was over a year. Your ovaries have stopped producing estrogen and releasing eggs. And then what you have after that is you have what's called post-menopause. This is the period after menopause. Makes sense that they would call it post-menopause. The symptoms of menopause, such as hot flashes and night sweats, usually cease at this point, or at least ease to some degree. But as you grow older, you can become more prone to health risks related to the loss of estrogen. Now, menopause diagnosis and treatment. You might suspect that you're going into menopause when you keep track of your periods and chart them as they become irregular. This helps your doctor determine if you are menopausal. There are other blood tests your doctors can do, to help diagnose menopause. But again, oftentimes when you're healthy, there's really nothing to do because it's a natural process to go through. Note that menopause is a very natural process, and most symptoms will certainly go away with time. And again, you don't really have to do a whole lot. When doesn't mean they don't suck though. Sometimes when you have them, but when problems do arise during menopause, then there are some medical treatments available, including hormone replacement therapy, topical hormone therapy, medication for osteoporosis, etc. But there are a ton of lifestyle things that you can actually do. If you have hot flashes, you can certainly sleep underneath a fan or near a fan, drink cold water before you go to bed, or dress in layers if you get cold. If you experience vaginal dryness, you can use, certainly over-the-counter moisturizers for that, or particular things like coconut oil as well, which also tend to work really well. If you have sleep problems, you can try exercising more often because that actually helps sleep, along with a ton of other sleep hacks that we've talked about on this podcast before. Avoiding smoking, limiting your alcohol intake, staying mentally and socially active, to prevent, memory problems, word puzzles, those kinds of things, and just eating a variety of healthy foods, to help maintain a healthy weight. So everybody's going to need something different. Some women are not going to need to do anything. Some are going to need to do a little, and some are going to need to do a lot to help themselves through this transition. But again, it's all the things that you do now that will determine how it's going to go when you actually get to that stage. So hope this helped you. This is Dr. Jason Jones. We're signing out, and we'll see you guys on the next one. See you later. Bye-bye.